Hello, welcome once more to Ask Your Midwife. Today I'm going to talk about abdominal puerperium. But before I begin this topic, I'd like to once again say that you can find Ask Your Midwife on Facebook page. That is, you can type Ask Your Midwife and you get most information that you need about maternal and child health. You can also find Ask Your Midwife on YouTube. Just go and search for Patience Afrifa, or you can simply type Ask Your Midwife and you get most videos which I have also posted there. Aside that too, if you have any question, whether you attended antenatal session or whether you had an encounter with your doctor or your midwife, things that you may or may not understand, don't hesitate to type the question and I'll get back to you as soon as I can. Today's topic is on abnormal puerperium. On the previous video that I did, I spoke about the puerperal period. That's the normal physiology that occurs after delivery in a woman who has delivered. I spoke about changes in the cardiovascular system, changes in the vagina, changes in the cervix, and I also spoke about changes that occurs in the ovaries. Now, today's topic, the previous one was about the normal physiology, as the normal things that are supposed to occur in the body, both physically and then within, as soon as the woman delivers. Now, we are going to talk about the abnormal things which you are likely to see, so that in case of anything, you quickly rush to the hospital for early intervention. All what I'm doing is all about early intervention so that it won't aggravate to complications for you. Right. Now, with the puerperal period, I'd like to explain again, though in the previous video I explained to you what the puerperium is all about. When we say puerperium or postpartum, it means that after birth. And this period starts as soon as the placenta is delivered, and its range is from 6 weeks to 8 weeks. Now, during these periods, you have to observe for signs of anomaly in your body. These anomaly will let you know that things are not going on well. Therefore, you need to quickly see your midwife or your gynecologist for early intervention. Now, one of the anomalies most of the times with the abnormalities is mostly due to high temperatures or rigors or chills. With this, it's mostly due to infections. It is infections that what causes, when it's being multiplied, one of the symptoms is that your temperature may go up, that is 38 degrees Celsius, or there could be tendency that you may end up having chills or rigor. All right. Now, what are some of the things that will predispose someone who has delivered to these signs of fever and then chills? So, what are some of the infections that a puerperal mother or a woman who has delivered is at risk of encountering? First and foremost, the most common one is mastitis, of infections of the breasts. How does it come about? Let's bear in mind that when you come to the hospital or even during pregnancy, we do what we call pregnancy school. The school it entails a lot of activities which teaches mothers on how to go about during labor and also after birth, and even during pregnancy, some of the common things you see and how to manage or go about it. Now, how to position and attach a baby to breast is one of the components of pregnancy school. We teach our clients or our mothers how to properly attach and position a baby to breasts. And not only the clients alone, including their husbands. That is why we are always pushing for male involvement. When the men are parts of it, they assist us and they make things easier for us, because at the end of the day, the baby is for you and I, the same way as the pregnancy is for you and I. That is both the mother and then the husband, as well as the family and the midwife as a whole. Now, when you position and attach a baby to breasts, Ideally, the baby is supposed to take the areola. When I say the areola, that's the darkened part of the breast, not the nipple. I realize that most of the times, babies end up attaching or latching to the nipple. And when the baby attaches or latches to the nipple, how will you know? You realize that the baby starts making noise whilst breastfeeding. Ideally, when the baby is breastfeeding, baby is not supposed to make noise. By so doing, it involves a lot. The baby, as it's making noise, is taking in air instead of the breast milk. And at the end of the day, the baby's abdomen becomes distended and may end up having abdominal pain and also discomfort for the baby. And the breast too, due to the pressure of the on the nipple, there'll be cracks which will form around the nipple. And these cracks will serve as portal of entry for microorganisms to enter to cause an infection. When that happens, as the microorganisms also multiply, it causes the mother to have fevers and chills. Not only that, the breast becomes engorged, not because of the entry of the microorganism, but because of the pain. Most mothers refuse to breastfeed, and there will be amounts up of breast milk in the lactiferous ducts and glands, as well as the ampulla where the breast milk is stored, thereby causing the breast to become engorged, shiny, and very painful and warm to touch. This we may see it as something small, but can go as far as the woman being hospitalized or being attended to in the hospital because an infection has set in and she needs the care of the attention of a caregiver. Then we can also talk about genital tract infections. After birth, you know that there will be trauma at the perineal region due to the expansion of the muscles around the perineum for the baby's head to come out. So there may be tears around or lacerations around that site. And those two who may not have that too may have what the midwife may give what we call the episiotomy incision. The episiotomy incision is to aid in childbirth. We give that incision because of these reasons. At times, the baby's head may be seen in the perineum. The mother may push as much as she can, but the baby's head won't progress for it to be delivered. And when the longer the baby stays in the perineum, the more the baby's oxygen concentration also diminishes. Therefore, the midwife needs to intervene by giving that generous and timely episiotomy incision in order to create or to widen up the space for baby's head to be delivered. 2, we also have mothers with rigid perineum, especially the first-time mothers whose perineum has never been tried before. So when the perineum is too rigid, then the midwife will have to give that episiotomy to create enough space. So the episiotomy incision is simply to create enough space or to expedite delivery. Now, as that kind of incision, in our field, it is called intentional wound. Intentional wound because it was done by intention in order to deliver the baby safely. Now, as soon as this wound is made or this incision is done, the midwife sutures it under local anesthesia. She sutures it and brings the muscles and the skin back into apposition or back into alignment in order to also arrest hemorrhage or hemostasis or to control bleeding. Now, this wound which has been created and has been sutured, as you are going home, your midwife will educate you that when you go home, don't sit on hot water, but you do warm sit bath, and then you clean the perineum with clean water. I realize that when people go home, they go to do the contrary. Even the antibiotic cover they give them, some don't even take them at all and resort to other medications. Now, let's bear in mind that that incision can also serve as a portal of entry for microorganisms to enter. Also, as soon as you deliver, we have what we call the lochia flow. The lochia is just like, to bring it down, it's like a menstrual flow, but it's not menstrual flow. It is a flow that comes from the placental sites. So as the placenta Placental size starts diminishing, or as the uterus contracts and then reverts back to normal, the size reduces, and that affects the color, the consistency, and the amount of flow that comes out of the vagina, which you see as bleeding. Now, so far as you are bleeding, or so far as the lochia is being fluid, within the 6 weeks period, you are supposed to take care of your perineum by cleaning the place, changing your pad frequently, washing your hands with what? Soap and running water, so that you wouldn't introduce infection to the site. But here lies that some people do the contrary. Perineal pad can stay very long there and it starts giving offensive smell. And bear in mind that microorganisms thrive very, very well. They multiply very well. In what? Fresh blood. It serves as a good medium for them to what? Multiply. So that means you are creating a space for infection to occur. So that is how come you end up getting infections and your temperature will go up, and then you end up getting fevers and then chills as well. Then we are talking about urinary tract infections, or UTI, which most of us know. The UTI mostly comes about due to the I'll say that the medical observations we use to take care of a woman. When the woman comes for labor or comes in labor, and then ideally she's supposed to urinate frequently. As the head is descending, it puts pressure on the bladder, so she needs to void and empty the bladder to create space for the baby to also descend. And emptying the bladder during labor helps what? The uterus to what? Contract effectively, and also helps the cervix to also dilate well for you to deliver safely. Now, here lies that there are some clients who tell you that I cannot urinate, and the midwife has no option than to help you to urinate, because when the bladder becomes too full, it affects labor. It can make labor prolonged, and the more labor is prolonged and the more the baby stays there, the more baby is at risk of asphyxia or any other complication that may set in. So technically we need to pass what we call a urethral catheter in order to help the bladder to what? Be emptied, so that labor will be well, or contractions, which we call the power, because for a woman to go through good labor, you need the powers, which is the contractions. So the uterus will be able to contract well, the cervix will be able to take up well, the head can be well applied to the cervix for easy retraction and then for delivery. So the catheterization and also the vaginal examinations. The vaginal examinations during labor are done every 4 hours. But at times, pregnant women, when they come in labor, and let's say I came before Adwa, but Adwa came to deliver before me, remember that you and Adwa are not the same person. Because when Adwa is someone who has delivered so many times, that means the service has been tried. So her dilatation is always faster and easier than Akosua, who is a first-time mother, and it's the first time that she's going through, or the service is being tried, or the uterus is being tried for birth. And then we also have people who have precipitate labor. They come and they easily give birth. So labor is different from what will happen to me in my labor is different from what will happen to Akosua in her labor. So when you come, you don't force the midwives to do frequent vaginal examination, put pressure on the midwife, because the midwife is using a monitoring board to monitor the progress of your labor. So all the time you have to adhere to certain midwifery advices. But if you put pressure on her and then there is frequent vaginal examinations, you are at risk of urinary tract infections. Yes. And then we can also talk about mothers who also come with eclampsia. Eclampsia is mothers that mostly fits or jerks, just like that of epileptic patients. And due to the drug we give them, that drug we have to monitor for the urine output. So we pass a urethral catheter. And those people too have the tendency of staying on the ward for long. So they are also at risk of UTI. So when you go home during the puerperal period, that is why you need to visit your midwife. First postnatal, that's first 48 hours or up to 72 hours. Then you come 1 week. Then you come 6 weeks. Unless you have a peculiar problem, then your midwife will schedule you to another visit. Then you visit the facility. She will examine you from head to toe. Then If there is any anomaly, she should be able to detect it on time. So please, after delivery, don't stay at home. Just come for postnatal services for the 3 visits at least, to be able to clear off any other thing. And then when you have questions too, you also ask. Postpartum period, anything can happen. Your midwife will give you her contact number as you go home. If you don't understand anything, you can call your midwife to also help you with settings. So when you deliver and you start having frequency of micturition, burning sensations around the genitalia or the lower abdomen, back pain, don't hesitate to come, so that we take you series of tests in order to rule out urinary tract infections. Then we can talk about almighty malaria. During pregnancy, you realize that when you go for antenatal, we hammer on the use of insecticide-treated bed nets. We say this because as a pregnant woman, when you contract malaria, you are at risk of intrauterine fetal demise or a stillbirth, or you can give birth to a baby with low birth weight or an asphyxiated baby due to the depletion of the red blood cells, which may occur when you are pregnant and you expose yourself to malaria. And it doesn't stop there. When you deliver, you have to also continue to protect yourself and your baby, so that both of you won't be exposed to the parasites. So during puerperium, it does not deter you from using. That is even the time that you need it more, because bear in mind that the baby is vulnerable, and so are you. Already during labor, you've lost blood, and you need to replenish that blood in order to nourish your body, be healthy, eat well, in order to also breastfeed your baby. So mothers, please don't expose yourself to malaria. Sleep under your insecticide-treated nets. And then also other modifying behaviors like the silting of gutters and then clearing bushes around the house, not overwhelming the room with clothing. That one can serve as a space for mosquitoes to hide and also multiply. And then when you are even sitting outside, you can wear long sleeves or long dresses or even socks to prevent yourself from being exposed to malaria. Alright, then we can talk about upper respiratory tract infections, or URTI. When you've delivered, it doesn't mean that you are immune to certain infections. You are also at risk of upper respiratory tract infections. So you have to, as much as possible, make sure that you don't expose yourself to dust or to perfumes or things that will trigger any upper respiratory tract infections. And let's bear in mind that we are already in the COVID era, so bear in mind that you have to use your face mask. It also helps to prevent upper respiratory tract infections a lot. I'm the type that I am easily prone to that, but since this COVID came and I started using the face mask, apart from it preventing me from getting the COVID, I realized that during this time that we were exposed with this virus or this COVID, I've not had any upper respiratory tract infections. Thank you very much. I believe that with these informations that I've given, when you go home as a mother who has been discharged from the hospital, you adhere to the advices of the midwives. Take your Maternal or what we call the mojedro in our dialect. You take your Maternal, then you take your antibiotics, and then you take your painkillers. Those with episiotomy incision, please don't go and sit on hot water. When you sit on hot water, the place will gape, where it was sutured will gape, and you come back for second suturing. And that one is even more painful than the first. Aside that, you are at risk of scalds or burns when the water is too hot. Lukewarm water is fine. You use it to clean your perineal area. You wash your hands. Just normal personal hygiene, and you are good to go. And also, when you have any question, please visit your midwife, or better still, call her to guide you. Thank you very much. Once more, my name is Patience Efrifa, and the program is Ask Your Midwife. If you have any question, kindly send it to me. Don't forget don't forget to subscribe to my channel, which is Ask Your Midwife on YouTube, and don't forget to like and share as well. Thank you very much. Bye.